Well, hello. I'm Lisa Ratu. I'm Minister for Congregational Care. I'm here with Rob Blackburn, our senior pastor, and this is Cindy Oak. Cindy is the chairperson for our Congregational Care Council. And we're here today to talk about something really exciting that developed through our Congregational Care Council, and that is our new well-being resource list that is located on our website. And Cindy, I'll let you talk about kind of how this came to be and maybe give us a general overview.
Well, thank you for having me here today. It came to me that questions come up about resources in the community, who to call when you have a need. Our Stephen ministers frequently bring this up, and I have a care receiver who needs some help, and they're not really sure what agencies are available. And to be honest, when Maureen Carr retired from her position as our parish nurse, I realized that she was a connector to a lot of agencies, and we didn't really have that at our fingertips anymore. And so between those two, I started to have this idea that we needed to have a new care ministry, but instead of having people in a group providing these connections, it would be a website or a web page on our website. And so I thought of Susan McCracken, who had a lot of skills as administrative assistant in her career. And I asked her if she could help start gathering these, and she graciously agreed, with the one stipulation that she have a partner to work with. And at the same time that was happening, Lisa.
Meanwhile, I had connected with Elizabeth Nealon, who had voiced some desire to do ministry, but to do it remotely, because she was fighting an illness at the time, and she was a gifted attorney and a person who really cared about other people. And so we got Susan and Elizabeth connected.
And I just really felt like the Holy Spirit was leading this for that to happen that way. And these two ladies never actually met each other, but through Zoom, they worked for months on gathering and vetting resources. And, sadly, Elizabeth passed away in September, and she turned over the baton to me to complete the project with Susan. And I promised her that, that this would be her legacy to our church, because she had done so much work on this. And so that's how the Wellbeing Community Resource List came to be. And at that point, Susan and I finished the details, and then we turned it over to Rachel, who did the beautiful job of putting it on our webpage.
So what will people find when they get on the webpage? A list of contact information, phone numbers, email for these different groups that are serving?
Yes. Under Congregational Care Ministries on our webpage, if you scroll down, you will see the Wellbeing Community Resource List. You click on there, and there's 12 different categories, and starting with aging all the way to veterans.
I saw child care options.
Yes. And when you click on a category, you have the agencies in our community that are sort of what I call the umbrella agencies. They've been around for a long time. They're tried and true. They have access to what is available currently in our community. There's a web page, website number, link. There is phone numbers, and there's a description of what services they provide. So you don't have to go shopping around, even though we Google many things. This is like the beginning point to help you.
So a lot of Sarah and I are getting ready to embark on a journey through this new land called retirement, which now presents a number of questions, and some surrounding healthcare, insurance. So let's say we needed some help with how we move into Medicaid and how that couples with our current insurance program. Would that be something that I could get help?
Yes. If you clicked on the category aging, You would, I'm sorry, but we've all are.
That's appropriate.
That's an interesting word, has lots of connotations.
That's very appropriate.
But there is a couple different options, and the one that would probably get you where you're going is the Office of the Aging, because they have many, many different services, and one is how to shop around for Medicare.
Okay.
Mhm.
Very
So
good.
And that would help even if you're not the aging person, but perhaps you're caring for aging parents
Uh-huh.
and
yes,
begin to need services and extra help. That'd be a
yes,
great place to start.
yes.
As the congregational care minister, I of course get a lot of questions about referrals for mental health services.
Mm.
So,
And that's a
We-
category that we looked at carefully, and there's a number of umbrella agencies that can hook you up with therapists and support groups. If that's what you need, they basically interview you on the phone and then determine what you really need, and then give you some options so that you're not having to try to figure out, is this someone that's appropriate, or
Yeah.
someone who I could trust? And they've already vetted those people.
That's a key word there. I think that you're going to get people that have been able to vet and that therefore make some recommendations that we
Mhm.
would feel pretty good about these different options. Okay.
Yes, we were aware that agencies come and go, and we didn't want to have a website that would become obsolete quickly.
Mm.
So we really were careful to choose agencies that have been around, that we know will continue to be here and available, and that would be able to point you in the right direction.
And if there are changes or certain of these groups just kind of come and go, we can update the website, right?
Yes, in the web page, in the introduction, where there is some background information, and then there is some instructions on how to use the categories, we indicate that if you happen on a number or a site that is not viable anymore, to contact Lisa.
Okay.
And Lisa will help us get that corrected or updated.
Right. Yeah. So
Th-
this is going to be kind of a living document. We're gonna keep up with it and be sure that it's useful.
Is there a place for our members to log in and say, I contacted this group and they were very helpful? Is it possible we can get that kind of feedback?
We don't have that right now, but that's a good idea.
I guess they could respond to Lisa.
could
because
respond.
They have Lisa's.
They could do it verbally, and we certainly encourage people to do that so that we know that it's a
That
useful.
helps us evaluate.
Yes.
So
Right. Yeah. You can always find my email on our staff page and just connect from there to send me a message.
right.
That'll work great. Good question.
I've actually already had a few people who are knowledgeable about agencies, check some of them out and say, these are really,
Okay.
really, really good resources.
I like the word you use, legacy. This is really a gift to our church, and I think about two women that got together, not even in the same room, and were able to collaborate and kind of help launch this.
The idea, as you know, from congregational care, is that we want people to know that they are supported and cared for, that nobody's alone. And this is just another avenue to provide support and care. And I've thought about this a lot. Some people, it's hard to ask for help. And so if you can confidentially and privately go to a website without people knowing initially,
Right.
You're more apt to do that than if you have to actually talk to somebody at first. Sometimes it's just hard to take that first step publicly. So here's another way to encourage someone who needs help to do it without fear that anybody's going to judge or not understand their situation. So that's another aspect of having this resource available to our congregation. And I encourage people to share it with people in their neighborhoods, to share it with other groups.
This won't be just limited to central members, anybody.
Right. I've actually even had a pastor of another church say, I'm going to use your resource list because I have those requests as well. And I was very excited about that.
Thank you, Cindy.
Thank you.
Yeah.
Well, we're excited. Thank you for having this opportunity to talk more about it.
Now, folks, let's use it. It's there.
Let's use it, share it.